Hello, good evening. Welcome back to I Care for Your Brain with Dr. Sullivan, board certified neuropsychologist. That is me. I am here with you. This is my way of bringing the art and the science and compassion of neuropsychology to you, the brain health community. I would love for you to hit the subscribe or follow button if you haven't done that yet, so you can stay in touch with us as we release free science-based brain health lectures. I have been a brain health care provider as a neuropsychologist for 10 years now, and I've had the privilege of hearing many brain health journeys that all too often include disappointing experiences with medical providers, diagnoses that aren't well explained, expertise that isn't shared, support that does not feel genuine. And I'm not saying all brain health care providers, but what I'm saying tonight is too many. So what I want to talk to you about are 4 things that I think are non-negotiables in the brain health medical provider-patient relationship, but I'm afraid you're not getting. As we go through this list, I'm going to ask you to share with me what is your opinion about your brain health care provider. How do you think they're measuring up on each of these 4 things we're going to talk about tonight? So the very first thing, kind of the essence of all doctor-patient relationships, should really be engagement. Engagement is at the heart of the patient care commitment. The way that we show other people that we are engaged with them is by connecting, by having the willingness to engage, by being open. And when we do that, we can fill our interactions with meaning and a sense that you are important to me. This is really the essence of our integrity as human beings, that we are seen and that we matter. One of the things I'm going to ask you to do tonight in our time together is to contemplate your experience, absolutely. But I also am hoping that maybe you can develop a little bit of empathy on our side as medical providers. Now, I believe that most people get into the helping profession because they have a genuine heart of service and they do want to provide people with help and support and get them out of pain and distress. Once you work in the medical system, though, for a little bit of time, what you do notice is that the demand for volume can really weigh on you and can really lead to the syndrome of burnout. And one of the symptoms of burnout for doctors is that they start to really struggle with engaging, with having enough bandwidth, with enough mental energy to really be able to engage with their patients. And over time, the doctors can develop some pretty bad habits in the name of efficiency or self-preservation, but ultimately not engaging with our patients actually becomes part of the burnout cycle. We lose our way, our sense of meaning of what got us into these helping professions in the first place. Low engagement is bad for you as a patient because the less you are involved with me as your doctor, the less science tells us you're actually going to become engaged with your own health. You're going to be less likely to report the early signs of illness and disease, and you're going to wait until there's an emergency or an acute care issue before you actually come in. Unengaged patients are twice as likely to delay their care and more than 3 times as likely to have unmet medical needs because you just don't feel that connection with your doctor. Now, engaged patient does take more time, and that's part of the struggle in today's medical system. It's true, but it really is worth the investment for everyone. It's worth it on your end, certainly as a patient. It's really worth it for me and my quality of life, and it's worth it to the medical system, the hospital system. Patient and provider engagement is very tied into things like satisfaction scores and really hospitals' bottom line. It really does make sense. Now, one of the most painful parts of that burnout syndrome is when we start to depersonalize our patients. This is really bad for everyone involved, and it's almost always not a conscious choice. I really don't believe that doctors aren't wanting to engage. I think they're being asked to do things that sometimes they just don't have the reserve to do, trying to get water out of a well, so to speak. I really believe that most medical providers would like to do this if given a different set of expectations. The essence of what we bring to you as patients as an engaged provider is really that openness. Yes, you are coming to see us because of our technical skills, our ability to give you a correct early diagnosis, our ability to give you expert recommendations, but I think the very first thing that we have to bring our patients is our humanity. Our communication style that we adopt with patients really sends some very quick messages as soon as we enter the room. So it's as simple as, are we interested in engaging, or do we really have our own agenda? Are we wanting to connect? Are we open, or are we closed? We make that determination as people within milliseconds of all interpersonal encounters. And one of the most important things is where our eyes are focused when we come into the room. The next time you're with a doctor, I would love for you to pay attention as they walk into the room and think about, what is the first thing that they look at? Is it you, or is it the computer or the keyboard? At the beginning of an appointment, you probably have an agenda, what you want to talk with your doctor about. And we have agendas too. We've probably just been looking at your medical records. We've been with other patients in the morning. We have questions we want to ask. We have labs we want to think about if you're a medical physician. The limits of human working memory tell us we only get about 6 to 7 slots that are available at any given time. So the concern is that if doctors come into appointments already filled up with their own agenda, with their own priorities, then we're not leaving enough space to actually have a spontaneous, meaningful interaction with our patients. Eye contact is something that appears to be so simple, but you'd be amazed at how many doctors don't really have that down pat. The eye contact is essential. Once we are actually connected, the next job a doctor has when they are engaged with you is to convey warmth. Now, one of the things we know from eye tracking experiments is that warmth is typically conveyed non-verbally. It really comes from the look in our face, the way our eyes are turned, the shape of our mouth. After nonverbals, it's our vocal tone. Some people call that the smile with your voice. And after that, the third thing is actually our words, verbal communication. So this is why it feels so much better when a doctor comes into the room and faces us, as opposed to just facing in the computer. The openness of our body to engage really communicates a lot of our intention. What certainly does not show engagement is when our doctors are late, significantly late for our appointments, more than just, in a blue moon. This is a personal pet peeve of mine. I certainly don't love it when doctors are late, but what really gets under my skin is when they don't acknowledge that they are significantly late or apologize for it. The later we are as doctors, the more we owe it to our patients to just simply acknowledge the reality that we are late. When we're not acknowledging it, and a person's been waiting 45 minutes to an hour in a little room waiting for us to come in, it's really a form of gaslighting. We're basically saying the reality you've just lived for 45 minutes is not real, and it's certainly not a way to start off an engaged clinical encounter. So just acknowledging this, I think patients understand that we are human as well. And if we are able to come in and say, the day just got away from me, or I was busy with another patient, I think people typically are understanding. The concern is when it's not acknowledged at all. So this is our first point of a must-have in the doctor-patient relationship. This is engagement. So what I would love for you to do is rate your brain health provider on a scale of 0 to 10. So 0 is no engagement at all, you get no interpersonal connection, and 10 is that they really excel and you walk out of your appointments with your neurologist or your primary care doctor, your neurosurgeon, feeling really, really, really connected. The second thing is empathy. Empathy is something that we need from our brain health doctors. Empathy is feeling alongside someone without judgment. Empathy is that feeling of a pull, a feeling like an instinct, a feeling like you want to go towards the person who is in distress or suffering and not feeling like you want to go away. It's really a willingness to be present and a pull to help. And doctors show their empathy to patients in 3 main ways. The first one is active listening, right? Really making that conscious commitment to be mindful and to be open, to not own the agenda for the whole patient appointment. The second one is compassionate responding, and the third one is turn taking. These are all rooted in Carl Rogers' concept of unconditional positive regard, which says that we meet people where they are and we accept exactly where they are in any given moment. Compassionate responding happens when we make sure we heard correctly from our patients. When we say something like, did I get this right? Was that what you were wanting to tell me? I want to make sure I confirm with you that this is the most important thing. What compassionate responding is oftentimes not is kind of the immediate rushing in to solve a problem. It's very important that we slow down when we talk to our patients, especially people who have brain health challenges. We may have word finding difficulties, we can have slowed processing speed, we can have poor sleep, anxiety, depression, chronic pain, medication effect, all these different things that can make the brain health patient have a little bit more of a need to slow down and be able to formulate their responses. Doctors can kind of be on the complete opposite end of the energy spectrum and come in so amped up because we are running so hard all day. So two people just start off on two totally different energy planes. So it's very important as doctors that we give people the space to talk and we don't jump in and try to hurry them along to a resolution. Turn taking means that, again, for every time I speak and I want to express something important to my patient, I'm also giving them the space and time to respond. Communication is a dance of giving and taking, sending out and then receiving back. It is important that doctors wait to get a confirmation that their important messages were actually received. Every communication is really as simple as a sender, a message, and a receiver. So it's really important that we train doctors who are coming out today to make sure that they are getting in those three elements of communication: the receiving, the sending, and the getting back. Brain health doctors especially, like I said, it's really, really important that we slow down and don't trample over people when they are trying to help us understand their experience. The reciprocity of going back and forth is what builds interpersonal connection. It's the way we communicate that this is important to me. The cornerstone of all relationships is trust. Trust is not something that comes quickly. It's not something we can demand. It's something that comes in layers from repeated interactions and transparencies with people that at our core says we are two human beings sitting in the same room. We are not engaging in a hierarchy of doctor up here and patient down here. So when there is empathy with your doctor, what they are communicating to you is, I am a safe person. You can trust me with your symptoms. You can trust me with your fears, your uncertainties, with your questions. Just recently, I became aware of a UK group called the Neurologic Alliance, and I am so impressed with them. I'm so aligned with their messages. They're really focused on trying to advocate for people in the UK who have brain health challenges to get quick care, to get care that is full of empathy, to get care that is rooted in education. And so the last couple of years, they've come out with a data survey of this year was over 7,000 people living with a brain health diagnosis. And about a third of them said that their diagnosis was not handled sensitively at all. So they felt that there was a lack of empathy in the brain health doctor communicating to them, this is your diagnosis, this is your set of symptoms. So I want to ask you, and listening to me again, let's rate your brain health provider. Where do they fall from a 0, not feeling that there is sensitivity and compassion and concern, all the way up to a 10 where you just feel like they're hitting it out of the park, that you have shared moments of tender humanity together. Some of the most beautiful parts of my experience as a neuropsychologist is those moments of just sitting in silence where someone's humanity is just right there, and there is a realness and a rawness to what they're going through, and I am able to just be present with them, not necessarily solving their problem, but just showing that we have a connection and a joining together, and that we are working as a team, and that they are not alone with their symptoms. The third one that I hope you're getting, but I'm worried you're not, is a sharing of expertise. So what do I mean by this? What I mean is that the doctor, the medical provider, isn't holding that they are the only expert in the room, okay? When we value your experiences, what we communicate is that we need your input in order to do the very best job, right? I come to the interaction with degrees and education and compassion and concern, but what I don't have is the lived experience of what you are going through. And so what we really need is the objective understanding, the academic book knowledge, the expertise I get from having seen hundreds or thousands of other patients similar to you. But what I can't give is what it's like to live inside your brain. As a neuropsychologist, as a good example, I see a lot of folks who've had strokes, right? And I always want to communicate to them that I do know a lot about cerebrovascular disease and ischemic stroke and hemorrhagic stroke, but at this time I have not had a stroke. So what I don't understand is what it was like to be them living in that brain through those set of symptoms, and that I am genuinely curious to know about a whole host of different things, their physical symptoms, their emotional adjustment, the way it's affected their family, the way it's affected their livelihood, their finances. There's so many different things that I am curious about, and it sets the stage for a very respectful experience between both doctor and provider. Communicating the message that our patients' experiences are important, that their firsthand knowledge is expertise, is a very, very important part of the brain health doctor-patient relationship. And it really gets to this idea that at the heart of patient-centered care is a commitment and an intention to share power. Sharing expertise is a very important way to show that we are both experts here, right? Traditionally, the more knowledge a person holds, this typically means they have more power, right? When people have more power, they tend to get more respect. Doctors get a lot of respect right out of the gate. We typically just see the degree on the wall, and there's this feeling like, hey, they're very educated, they're going to be able to help us. On our end, this idea that book knowledge is everything gets reinforced from the very beginning of our training. We want to have the best training, the most knowledge, the sharpest skills. We want to be chief, we want to be officer, we want to be executive. And those ambitions are good. This is how we get very learned doctors. But it is incomplete knowledge without the subjective, without the patient guiding us and helping us understand what it's like to be them. The very fourth one is maybe, it's really hard to say which one of these is my favorite because I think they're all important, but I'm very passionate about this next one, which is education. This is something that just really bugs me when a doctor is in a room and they are clammed up with their expertise, right? These are people who've gone to school for anywhere from 5 to 8 years typically. You know, in this brain of theirs, they have tons and tons and tons of knowledge about what it is you're going through, but they're just eking out tiny little things, right? When I go to see a doctor, when I need an expert, I want them to open up their brain, open up their mouth, and share. But unfortunately, this is not what's happening. So that Neurologic Alliance group has taught us in their recent report that 6 out of 10 people were not given any information or explanation about their diagnosis. And this is just unacceptable. This is why people fall prey to this brain fitness industry with its too good to be true promises of supplements and brain games. It's because us as traditional medical doctors aren't providing enough information. Every person who has experienced a brain health concern, a scare, an event, a diagnosis should receive, it should be mandatory to be given in-depth, high-quality information about the how, the what, the why, by a compassionate provider who genuinely cares about them. Education, really valuing that, puts the patient in charge of their own health. It's a way of sharing that power where it doesn't all get to reside in me. The reason I'm so passionate about it is because education reduces unnecessary suffering. When people don't understand what is happening to them, what happens is they have more anxiety, they have more uncertainty, and they become more disabled. And that's the complete opposite of what it is we want to do as brain health providers. Our job really is to uplift and empower our patients to help themselves as much as possible and to be our true partner, not just we say what happens, you accept what it is we say. So I would love to know, how has your brain health provider helped you in this area of education? Do you feel fully empowered with science-based knowledge and tools on how to live alongside your brain health challenge every day? How well have they taught you that academic side of the education equation? So I want to see that score again from 0 to 10, 0 being no education at all. 10 is, I'm getting quality time, I'm understanding some of the complexities, I'm understanding recent research, I'm understanding kind of how current neuroscience thought leaders are thinking about my current condition. One of the things, especially with movement disorders, as you know, that really irks me, is when the doctor only focuses on the observable, on the movement part of the movement disorder. Very, very, very few movement disorders are just pure movement. Almost always there is some cognitive, emotional, sensory, psychosocial element of it too that's just as worthy as talking about it. And when we don't talk about it, people then start to feel like, well, what's wrong with me that I'm having this symptom? Could I, we have a lot of health anxiety. Once we're diagnosed with one condition, we start to feel like, well, why not me? Maybe if I have this, I also have this other thing. So I want to know on a scale of 0 to 10, where you rate your people falling on education. In terms of engagement, empathy, shared expertise, and education, which one is it that you want the most? In your personal experience of those 4, if you had to pick one, I want to know which one is the most important to you. A brain health diagnosis is so tender because it presents a uniquely sensitive set of symptoms. It's really where the physiological and the psychological, the cognitive and the social meet. The standard approach to diagnosing and treating and managing people with brain health issues has become much too brief, too emotionally detached, not nearly as empathetic as us as fellow human beings need, and without nearly enough education. So despite 3/4 of adults with a neurological condition reporting that their mental well-being has worsened since their symptoms began, only 60% of people in the Neurologic Alliance survey reported that their medical provider even asked about their mental well-being. This is not okay. This needs to change. Part of why I'm here with you in the I Care for Your Brain program is I want you to see a neuropsychologist in action. Here I am in the wild. I want you to see the approach that we take to brain health care. This is how a lot of us neuropsychologists think. We are person-centered, we are holistic, we are psychologist first. So we are coming at your brain health condition not from a reductionist pure brain perspective. We really try to see the person in front of us first and the brain health condition and symptoms second. If you have not collaborated with a neuropsychologist yet on your care, I invite you to ask your primary care or your neurologist for a referral for a board certified or board eligible neuropsychologist in your community. There is no doubt about it. I hope you will agree with me that brain health care happens best when expertise comes from both patient and doctor. The academic clinical training have to meet the lived experience of the patient. Valuing the contribution of both types of expertise is how we're actually going to get to optimal care. The time is really now to move ahead with a person-centered, whole person approach to brain health care. So if you agree with me, I need to know what your thoughts are, how this information today has impacted you, how it makes you reflect and think about the care that you're getting now. I hope that you're able to report back to us here in the comments that you have a wonderful, equal, supportive, nurturing relationship with your brain health doctor. And if you don't, I hope that you will maybe be empowered to try to look elsewhere. You really are in a position of power many times as a patient, even though it might not feel that way, to ask for a second opinion, to ask for another referral. Oftentimes getting a word of mouth, thumbs up from someone who has a similar diagnosis can be a really helpful way of trying to get with the best providers that you have access to in your area. So like I started off saying, I hope if you have not subscribed to our YouTube channel or followed us here on Facebook, you will be doing that. The lecture tonight is really kind of the core philosophy that we use at iCare for Your Brain for deciding what type of brain health lectures we want to share, what type of webinars we want to do. It's always trying to come from that educational, empowering, compassionate point of view. So if you think that this is good for brain health care, please follow me here on the social media channel you're on, and you can go through our archives. We have over 150 free brain health lectures on here for the taking. So please join us and get as much learning and power from this as you possibly can. Thank you all so much, and I look forward to seeing you next time. Bye-bye.